Hello everybody. Welcome to the Teaching Academic Skills course. The content of these slides was created by myself, Dr. Leslie Neely, and Dr. Catherine Hoffman. I will be your guide through the modules while you learn about best practices for teaching academic skills to individuals with autism spectrum disorder. This module, Introduction to Applied Behavior Analysis and Defining Behavior, is the first module in a series of 5. You will complete one module per week and meet with your assigned BCBA in between modules. Please note that this work was supported in whole or part by a grant from the Texas Higher Education Coordinating Board. The opinions and conclusions expressed in this document are those of the authors and do not necessarily represent the opinions or policy of the THECB. So what are some of the questions we will answer in this module? First, we'll look at what is Applied Behavior Analysis, or ABA. We'll talk about what is behavior, why is data important, how do we define behavior so that we can measure it, and then we'll complete a defining behavior and collecting baseline data activity. So when people ask what is ABA, there are often a couple of responses. First, I don't know, I've never heard of it. People might think that it's for people with autism, or they think it's a type of therapy for kids with special needs. So I'm going to pull up this video that gives you an introduction to what is ABA.
So, what is Applied Behavior Analysis, or ABA? Well, Applied Behavior Analysis is a science devoted to the understanding and improvement of human behavior. Most people think ABA, that's like Pavlov's dog, right? Because most people who've had a psychology introductory course have opened their textbooks to behavioralism only to see Ivan Pavlov and the story of his dog who salivated to a bell because it was paired with a meat stimulus. But these are merely reflexes, and it's what we call respondent conditioning. But B.F. Skinner took behaviorism beyond Pavlov's dog. In his analysis of learned behavior, he called operant conditioning, and such words like science and human behavior. Many use ABA as behavior modification, or trying to reduce inappropriate behaviors, and they're very concerned with the behavior graph going down. And of course, applied behavior analysis can be very effective in reducing maladaptive behaviors. But B.F. Skinner considered applied behavior analysis to be a science of learning, where its greatest benefit was actually an increase in behaviors. All of the social behaviors like sharing, or academic behaviors like reading, or verbal behaviors like talking to each other. That is why applied behavior analysis can be so effective in working with children with autism and other developmental disabilities. Because with autism, there are of course a number of behavioral excesses, those behaviors which we're trying to reduce, but there are even a greater number of behavioral deficits or skills that aren't happening enough that we need to teach. Perhaps the most significant behavioral deficit with children with autism is in language skills, or their ability to effectively communicate with the rest of the world. This is why, in addition to ABA, B.F. Skinner's analysis and understanding of verbal behavior can be beneficial to working with children with autism and other individuals with language delays. Decades of research has proven the effectiveness of applied behavior analysis in reducing inappropriate behaviors and increasing communication and social skills. In fact, the U.S. Surgeon General has endorsed behavioral interventions as the most effective treatment with children with autism and other developmental delays. So next time someone asks you, what is applied behavior analysis? You're going to tell them it's a science devoted to the understanding and improvement of human behavior.
So as the movie we just watched stated, Applied Behavior Analysis, or ABA, as it is known, is a science. It is the science of systematically applying interventions based on the principles of behavior to improve socially significant behaviors in humans. And in ABA, we must show experimentally that the interventions are responsible for the behavior change. So kind of a simple translation to that mouthful is that ABA is the science of improving meaningful behaviors with interventions that are data-based, that we know work. And another way to translate it is the more technical definition. So let's break it down into its parts. So what is ABA? By exploring its parts, we can better understand what ABA presents. So first, ABA is a science, which means that it is derived from a body of knowledge that is continually evolving as we gain new knowledge. It is also systematic, meaning that a stitch in time saves 9. A behavior analyst will try one intervention in time and measure the behavior targeted for change. We also depend on taking data on the behaviors so that we can be assured that the change we see is actually measured. We also focus on socially significant behaviors. That means in ABA, we seek to improve behaviors that are important in everyday life. Intervention goals might include improving communication and social skills in a person with disabilities, or could help you quit smoking. Finally, ABA is experimental. Within each intervention, there must be a demonstration that the intervention is what caused the change. So while many people think of experimental as running research in the basement of a university or doing clinical trials on a new drug, experimental has a bit of a different definition here. Experimental means that within each individual intervention, an applied behavior analysis must prove that this is the intervention that caused the change in the behavior and not some outside factor. So why do we take data? Number one, we take data to see if an intervention is working. Number two, also, we take data so we know when to make changes if an intervention is not working. Furthermore, research shows that when people give impressions of students' progress versus using actual data, they tend to overestimate a student's ability. And finally, we have the evidence that tells us that when data is used to guide intervention and instruction, students make greater gains. So now that we are motivated to take data on behavior, we need to look at what is behavior. So simply put, behavior is anything that we do. This can include more obvious behaviors, such as walking or talking on the phone, as well as some less obvious behaviors, such as thinking or feeling emotion. So we know from our earlier slide that BCBAs must count behaviors to see if an intervention is working. However, we also have to define behaviors such that it is observable or able to be seen. So what exactly does this mean to define a behavior so that we can count it? Let's explore this by looking at a couple of examples. So this is our first example. How would you describe what you see in this photo? Some people might say this child is feeling frustrated. However, this is going to be difficult to measure. For example, feeling frustrated might look differently for each person. In order for the behavior to be measured, we have to define what we actually see in the photo. So what precisely do you see? Well, you see a boy who is clenching his fist and his teeth and putting his hand down on his head. This is a description that can clearly be measured. So let's try another. What are these children doing? Well, most people would say that these children are paying attention or listening to the teacher. But paying attention might be difficult to measure. What exactly is involved in paying attention? What specific behaviors are we looking for? So a more measurable definition might be sitting with eyes oriented towards the teacher. Some of them are raising their hands, likely in response to the teacher asking a question. So this is a definition that reflects behavior that can be measured. So let's do one more. This is a site we're all familiar with. What is this child doing? So quite obviously, he is having a tantrum. But how might we measure tantrum? How might you define a tantrum so that it is easy to measure? If we describe the behavior as flopping to the floor and crying, then we are defining it through behaviors we can see and thus easily measure. So hopefully these examples have helped to show how to define behaviors so they can be measured. And these examples will help you to begin to define prosocial behaviors in your own child that you would like to increase, as well as the interfering behaviors you would like to decrease. Defining measurable behavior is the first step in designing an intervention that we can make sure is effective. So now it's time to put your knowledge to action. Please make your way to Eli Atomy course page. You will be completing the defining behavior and collecting baseline data activity as it pertains to your own child. So you will find this activity and its specific directions on the Eli Atomy course page. Thank you very much for your attention. The following are references for the material presented during this presentation.